Many patients come to the dentist because they're experiencing problems with their jaw. Painful jaw joints, painful muscles, clicking, grinding, popping noises can all trouble patients and fall under the category of what we often refer to as TMJ or TMD, which is temporomandibular joint dysfunction. We will treat those patients usually with removable oral appliances, an appliance called a night guard or a bite splint, an occlusal guard, which generally is worn for patients who grind and clench their teeth at night and is used to treat the symptoms of grinding and clenching, what's often referred to as bruxism. There's also a newer appliance that we use called an NTI TSS, which is TSS stands for Tension Suppression System. And this is a much smaller appliance, which is generally fitted to be worn over the front teeth. Either of these, a night guard or a NTI TSS, can be fitted to fit the upper teeth or the lower teeth, depending on what works best for the patient and their dentition. But the NTI TSS is the only FDA-approved dental appliance which is approved to prevent and treat migraine headaches. It's very good at relieving the tension of the musculature of the face and jaws, and can prevent migraines and help to eliminate pain involved with grinding and clenching of the teeth.